We on?
Yes.
Hey guys, welcome back. Look who's with us. It's one of you. It is Amber Brandis. Amber was a viewer, and she wrote to us one day, and she's like, "What's up? I'm a viewer. I like your show. I'm a therapist." That's what you said, right? You're a
psychologist. Yeah,
psychologist. Oh, I thought that was an animal. It's just a piece of your shirt that I just put on the floor. And all of a sudden it took off like wildfire. Fire. It took off like fire because people had so much to say, and people, for whatever reason, are sort of obsessed with mental health.
Yeah.
And our own goodness up here between the ears. How are you doing?
Good.
Yeah, you've been really busy.
I've been busy.
You know how I know that? Because all I ever get from you is, in between patients, quickly want to just check in and say hi, which, by the way, flattered. Do you need Amber to move closer to me, Connor?
A little bit, yes.
Yeah.
That's not you. There. Okay, there you are.
No,
How do you look?
Oh, wow, there I am.
There you are. You look great.
Yeah, thank you. Thank you. I just came from Dry Bar downtown.
Oh, that's
I was
right.
getting ready. I was
You
prepping and primping.
Amazing. I was like, don't prep, just prep. More prep, less primp.
So, I tune in between sessions when I can, and I just
really cool.
Yeah, it's like my chill out moment.
It is?
Yeah.
Well, so as a thank you, we try to acknowledge whenever you, I don't know if you always hear that we say hi back and hope everything's going well, and then
I do hear
I inevitably just sort of compare you to my therapist who never checks in. Like, I could just say your name because there's no doubt she's not watching. So there you go.
Is she your friend yet?
No. Like, sometimes I text you just because I'm like, listen, lady, I have a friend who's a therapist. I don't need you. Someone wrote whatever. Someone's not happy with all my.
It sounds
therapy.
like
Yeah.
the other night you needed to check in.
How did you know that?
Because I watched the show.
Oh.
Yeah, and you said we had to talk about the fact that you had 2 glasses of wine.
Yes. Yes.
I needed to check.
Oh, I'm gonna make it a little cooler. Amber, let me tell you something. I'm a little bit of a health person. You probably picked up on that.
Mm-hmm. Yeah.
I'm super healthy,
Yeah.
and I don't drink a lot.
Yeah.
I don't love to drink. I have serious control issues. I like to be in it. I don't like to be out of it. But if I have a few drinks, watch out.
Yeah.
So, I'm one of those, like, if I had access to a phone back in high school or college and I had a few drinks, I'd be a disaster. A disaster.
Yeah.
So I should have texted you.
Yeah. I would have been. I was literally leaving work at that time.
For real? It was so late.
A few nights a week I work till like 9.
Okay.
Sometimes later, but I try not to do that.
Okay.
Because people want, so that's why my schedule sometimes is weird. People want early and night, and I'm more of a night person. So
right.
I would offer a night session far before I would offer my morning sessions are not my favorite.
Not your favorite.
But yeah.
So over the course of the next hour, if you have, or whatever along we go, if you have questions for Amber, let us know. Last time you had a bunch of questions and we didn't get to all of them. She's more than happy to answer. She's a, are you a psychologist?
I'm a psychologist.
Psychologist. She can answer all your questions about looking for a psychologist, finding a therapist, what to ask, how to act, what is worthy of one, what isn't, how things can be diagnosed. Let us know. Jump in. And Connor, just keep an eye on it, and you let us know what's happening. So.
Yeah, and I can say a little bit about my
absolutely. Let's recap.
And like that. So I am a psychologist. I work in. I never know where to look. So I'm gonna look at you because I'm talking to you. Okay. So
just so you can do this.
Yeah,
that's what a lot of people do, so that they can make sure they get everyone. Yes.
I work in Philly and I work in New York. So my week is split. I work in private practice. And it's in Midtown Manhattan. I specialize in eating disorders and OCD, so I do work with everything, but I see a lot of people with eating disorders and OCD. I work from a cognitive behavioral perspective.
What does that mean?
That means that the way that I conceptualize change, or the way, I guess I would say change is this triad. So it's thoughts, feelings, and behaviors. And if we can kind of make a shift in one domain, it makes a shift in the other domains.
Okay.
So it's the idea that often with people I'll start with the thoughts. Well, it depends, but if I say to someone if someone's depressed, what they're saying, their internal dialogue, and you talk about this a lot with regard to fitness and what you tell yourself, it's all ultimately what you tell yourself is very, very closely connected with how you feel and then how you behave.
That's interesting.
So,
Well, I'll tell you this. So I have a friend who is struggling with her weight. She's been struggling for a long time. And I said, I sat down, I was like, let's just talk about it. Let's just get it all out there. I just touched.
Right.
And I said, I have to say it out loud because you're a therapist. I don't want to be like, oh my God, she was like hitting on me. So I said, well, what's the problem? She's like, well, I'm always eating I'm doing too much crazy snacking between lunch and dinner, and I think that's where I'm putting on my calories. Then I eat this, and I was like, well, what about the food you're eating? She's like, the food's okay, I'm just eating too much. So I said, why don't you rethink it? Instead of worrying about what food you're eating and changing that, why don't you worry about instead of, taking a food group out, why don't you take a chunk of time out? So the time that you do the most damage, let's focus on that. So maybe that is different just enough that would actually work.
Right.
So she said, okay. So I said, no eating between lunch and dinner.
Right.
You're not going to starve.
Right.
You're not going to die. You're not going to be emaciated.
Yeah.
Okay? You're just maybe going to have to be uncomfortable for a little bit.
Right.
And then you don't have to worry about what food you're eating. You just have to worry about when you're eating.
Right.
So she did it for a week. She lost 4 pounds just because that's her tough spot.
Yeah.
So I went to another client. And I was like, what's your problem? I eat too much after dinner. I said, okay, eat as much as you want before. When you're done, you get 50 calories for dessert, and that's it. Mm-hmm. And it's actually helped them sort of rein in it a little bit. How am I doing? How did I do?
Okay.
What do you think?
I think I think that's more of a, my perspective is I don't think people can't lose, I work with a lot of people with different forms of eating disorders, but the way that I see it is normalized eating.
Yeah.
So it's almost I actually just recently told a client, write down not the food that you're eating, the time that you're eating it, and I of course do the thoughts and the feelings and the therapy part of that.
Right.
So it's okay, so 7 a.m. you eat breakfast, okay, and then what, I broke this down recently with a client in session, so it's not always, because then you look and you're able to really see that,
yep.
I am, eating, when I work with people binge eating problems, it's I'm eating at 1, and then I'm eating a little snack at 2:30, and then I'm eating 3, and it's what's going on, you know what I mean? And so it's breaking it down almost to the time frame, because normalized eating is the treatment for eating disorders, period. If I was going to give you one sentence of how people get better from any sort of overeating, I'm sure you would say the same thing. If you normalize your eating and you eat consistently, you will it will reduce overeating behavior. That's just science. I guess science.
But it's with anything, Amber. If I take my kids and they eat at 4:30 and then they bathe at 5:30, then they read their books and they go to bed, and I put that into a schedule and they do that consistently, it's going to be part of their everyday mainstream expected activity.
Right. And I think that's the treatment. That's how people manage their weight. That's how people manage their eating disorder. When I work with people that, it's if you do not eat consistently, that's recovery. That's what it looks like.
Right. We're talking to Amber Brandis. She's a psychologist. If you have any questions, Connor, how are you able to see if people have comments or questions? What's that?
It's this. It's everything.
It's all of those things?
Yeah. Well, I got it all.
All right. Good.
So how's your therapy going?
My therapy is good. So my therapy is interesting because it's not always for me. Mm-hmm. Because I'm and I wonder if it's a journalist thing. I like to know what you're thinking, right? So when I sit down and I interview someone, you're the only person in the room. Yeah. And I know what I want to get out of it, but I don't ask you questions, your basic questions. If this is the answer I want, I will ask you a question here, and here, and here, and here, and here, until I get this. Right? But I know that that's what's coming out. So when I go into therapy, sometimes I do that. So I'll be like, how are you? She'll be like, I'm okay. How are you? I'll be like, I'm good. Well, how was your week? It's fine, but how was your week? I'm like, it was okay. She's like, Jenna, stop. We're battling. We need to I want to get into you. I'm like, stop now. We're battling. Let me get into you. She's like, what is happening here? So sometimes it's like mental exercises for me. It would drive you nuts. But Amber, I'm funny. You would laugh.
I would definitely laugh.
You would laugh.
What I probably would say, because I definitely do self-disclose to a degree with my clients. And I think, for instance, and I think I made a mention of this on the show and it came through totally awkward. I made a comment we were supposed to go to Chile in March. Alana's grandfather ended up dying and we had to cancel the trip the night before, renew the plan. It was a whole thing. But all my clients knew I was supposed to go to Chile. Some of them know that I'm in a relationship, some of them do not. I have this, but some of them know, some of them don't. But so when I saw them, they were like, "How was Jenna?" You know, everyone like normal.
Right.
That's like normal interactions with someone, and it was like, you know, so.
But I have a question about that.
Right.
Are you on social media?
Yes.
So she isn't.
I'm very careful though. I'm very private.
Now you won't accept just anyone.
I will not accept. And so like when people view the show, like after the show, a few people like, if it's within like a day after the show, and I'm like, okay, this must be someone that I met in the show. But and like my people request me, clients request me.
And you don't. And you don't.
No, and I have my stuff very careful.
But like, if you're a client, she's not gonna accept you. I mean, she's amazing, but you can't be Facebook friends with her. It's never gonna work. That can't work. How can that work?
That's in some people's like pathology, is like boundaries and you know like a very significant interest. Like yours, yours isn't like there's a very significant interest in me. I think that sometimes comes from like a not the healthiest place. So like in that case, for instance, like there's certain diagnoses, and I don't need to go into all that, but like in that case, I would be much less apt to share things. Whereas like most, like I said, pretty much all my clients knew I was supposed to go on this trip. So when I came back, how was the trip? And I said in one sentence, I had a family emergency and I didn't end up going.
And that was it.
You know, a few of my clients, we have more relate, like, oh, my partner's grandfather died. You know, what, you know what I mean? Like there was maybe a little bit more depending on the relationship. And but I would, in that, it's funny because like, she probably gets you, but I would probably say, no, I'm wondering why, like when I have people that do a lot of that questioning of me, like I'm wondering why, you know, we're spending your time talking about me, like what is that about? You know what I mean? Like I always try to kind of get a sense of that.
Sure.
You know, and it's like your nature and your background. So yeah.
So having this, and I'll get to you in a second, Connor, having this this access to you would be like, so I'm pick a show that I love. I love Veep. It would be like me sitting down with the director and asking everything I want to know. Me diving into your mind to find out about therapy is incredible. Okay, go ahead.
Okay, Brian Kelly asks, how do you tell if someone could be, how do you tell and what signs could you pick up on to tell if someone is bipolar? Sorry.
Did you, I know one. Maybe the way you're reading that question. Okay. How do you, what happens?
I'm trying to translate English into English.
Shoulder.
How do you tell or signs of someone who could be bipolar?
How do you know if someone's bipolar? That's a good way.
So if someone's bipolar, it's mania or hypomania and depression. So without going into like detailed diagnoses, there's typically like an impulsivity and irritability and elevated mood, like beyond just being like a happy person. Often people that are bipolar engage in
peaks and valleys.
Yeah, like that, like peaks and valleys. But it's also like I worked with someone that was bipolar, not medicated, and if people are medicated, they can be like neutralized much more. And the person went out and bought a car without thinking about it.
Oh wow!
So it was like, okay, we had a pretty significant conversation about that. And then obviously there's a depressive component as well. And I mean, I think that the pretty characteristic signs of depression that we all know. But it is that the highs and lows. But with bipolar disorder, like I work with people that are bipolar, and like their medication's really necessary. Whereas I think certain other disorders and diagnoses, like you could start out with therapy and then maybe add the medication thing, or maybe not. You know, whereas with bipolar, like often the neutralization is really important.
Okay. Go ahead. Good luck with this one.
Selena Marie says, my anxiety is going to kill me. I don't even want to leave the house.
I'm going to go ahead and diagnose it while you're drinking. I think you have an anxiety disorder. Okay, go ahead. Now you jump in. Jump in anytime.
So what I tell people, and I have anxiety myself, so I mean I could definitely, and so I think, and you know what's interesting about that, and like I share that with my clients when it's appropriate, because I think it's like I'm a real person, you know, experiencing like, you know, maybe not that same degree of anxiety, but like I have a lot going on in my life right now. I'm planning a wedding. I have a lot, and like my anxieties, I have a lot of anxiety. I mean, there's a lot going on, and I'm, you know, so I know what it feels like. But what I would say is that no one has ever jumped out of their skin from anxiety, and that's what I always tell my clients. Like, no one has ever died, and no one has jumped out of their skin. So it's like, you know, I think it's about using the kind of the basics, like mindfulness, meditation. I think yoga. I think those are things that are so kind of appreciated and underutilized. Like being able to regulate your breathing and the whole conversation about anxiety, it depends. Like if I talk about OCD, I talk about increasing anxiety. In this situation, I would talk about decreasing the anxiety because it's about getting yourself to a functional place where you can leave the house.
Yeah.
You know, whereas OCD treatment's kind of a different camp.
Sure.
So that's what I would say. I would say like, you know, you need to be able to, you know, get your body physiologically down to that level. Also, I think with certain anxiety disorders, you do need medication. And I think medication can be a short-term use while you're in therapy kind of building skills and building the ability to manage it.
Someone just wrote in that what can they do for social anxiety if it hinders athletic competition?
The comment was, what are some of the effective ways of dealing with social anxiety that hinders athletic competition? Yes.
I'm not sure I get that, but like I have social anxiety.
Right.
Like I love, and you know what my therapist says?
Yeah.
What should we call her? We'll just call her my therapist.
Yeah.
She says, because I am super comfortable in a situation where I have a role. So I could be going to like a huge event with 10,000 people, but if I'm hosting it, or if I'm the speaker, or if I'm the word presentator, or the MC, no problem.
Right.
Walk in like I own the place.
Right.
But yet I can't go to something like that if I'm just a guest.
Yeah.
Like if I'm just there in the audience, like watching, no shot. If I'm emceeing it, I'll walk the red carpet, I'll do the pictures, I'll do media.
Right.
Not a problem. I have a role.
Yeah.
I'm not good. Even with my friends, like I can go with my immediate friends, but with a group of like 12 people, like it's difficult for me to go and sort of be there if we're all just hanging out, as opposed to if it's my birthday or I have a role in it.
Well, like last time I think you were talking about like the Today Show Christmas party.
Couldn't do it.
You just had to have like 5 people.
Would not do it.
It was like really a whole thing. So the question was about athletic performance, social anxiety hindering athletic performance.
And he just clarified, he's saying when competing, he's being distracted by anxiety.
So what I would say in that situation is using, there's actually a breathing technique. You know what? I think I'm going to
in 4 seconds, hold 7, out 4, or in 7.
This is even better. This
in
is
3,
like,
up 12, bound 2.
This there's actually a breathing technique that a lot of my clients like, and they
show
use
it to
like,
us.
when they're in situations.
Give it to me.
So I want everyone to think about a flower. So I want you to think about a flower. And tell me what type of flower. Do you like flowers? I mean,
I like flowers. I like flowers.
Right. Okay. Okay. So think about a flower. What type of flower is it?
It's a lily.
A lily. Okay. So how would you hold it? Would you hold it like
Well,
this?
do you want to know why?
Why?
Would you care?
Yeah. Tell me.
Because I don't like flowers, but Stephanie sent me all these flowers once when we were dating. It was my birthday, and it's because the lily means I dare you to love me. So she sent me all these lilies. So it's really sweet. It's from a movie. It's from Imagine Me and You. But I fell in love with the lily. So
wait,
it's the
Imagine
lily.
Me and You?
Yeah. With
That's
Peekaboo.
a gay movie?
Yeah. I don't call it
Wait,
that.
I've seen, no, wait, sorry. I was just, because I love those movies.
Yeah.
So, yeah, I've
You
seen
love gay movies. Do you like porn? Porn's also fun. You could watch porn.
My mom.
Is your mom watching? Oh, God. I can't say porn. I'm not going to say porn anymore, Mom. Amber's mom not saying porn. Let's just stop. It's a great scene. And she sent flowers with Lily, and I dare you to love me.
Oh, right.
Shut up, she's British in the movie. Calm down, that was a brilliant accent.
Yeah.
It's a Pakistani movie. I dare you to love me.
It was so,
right?
That was a good movie.
Great movie.
I love that.
All right, so I'm holding my lily.
Okay, so you hold your lily. So you hold it like this or like this? You hold it like this. Okay, so you know what it smells like, right?
Sure.
Okay, and then I want you to imagine a candle in the other hand. What type of candle would it be?
I don't even know one type.
So like, would it be like tall one, the thin, like this, like a votive?
Oh, it would be a thick one.
Okay. It's probably, we're going to call it an unscented candle. I want to say this very clearly, never do this with a lit candle. I tell everyone that. Oh, no liability. This is a
Don't do the imagination thing with the lit candle?
Yeah.
Okay.
You never know. So, okay. So I want you I'm going to tell you to smell the flower, so you inhale it slowly into your nose. And then you blow out the candle, but it's really slow. So it's like, so it's very slow. So I'm going to do it to the sound of my voice. We're going to do it for like 15, 20 seconds. Okay.
Too much. Bring it down to like 3. Just kidding.
Okay.
15. Here we go.
Smell the flower. Blow out the candle. Smell the flower. Blow out the candle.
If someone's just tuning
Smell
in.
the flower. Blow out the candle. So we would do that for longer, and it's so what that does.
Hyperventilate.
No. So if you hyperventilate, the hyperventilation would be like.
Oh, cool.
Sometimes I use that's great. So sometimes like people are like really anxious people, and the whole point is it regulates your breathing and it gives you like a visualization.
Gotcha.
Like I really have people that literally like at work step into bathrooms and like do this.
Really?
Yeah, because it is a visualization thing, and a lot of times like flowers can be comforting and candles can be comforting. Like there's like reason behind it.
If Lance did it, obviously he'd be allergic to the flower, so he'd breathe in the flower, then have an allergic reaction, and then sneeze to blow out the candle. He would do that over and over again. If it was Lance.
Speaking of allergic, I wanted to bring my dog, but I didn't because Lance can't have a dog here.
Can't have a dog here. No.
So it would have been.
Lance is allergic to everything. You can't bring anything here. Literally, we can barely walk in. He like starts sneezing when we come in. Seriously. Go ahead, Connor.
First of all, Kathy K said sorry for sending you flowers.
No. You don't understand. It's not like that. I just meant I love the lily. I'm beyond appreciative of the flowers. They were absolutely gorgeous and lovely, and what an unbelievably beautiful gesture. So thank you so much from the bottom of my heart.
And then Terry Gilmore, this was something we already discussed, but maybe just recap it. She said, what can one do that recognizes the signs of bipolar, especially to someone who, the comment disappeared, but someone who won't go in for consultation?
I think that's really difficult with any disorder, because I feel like all you can do is let someone know that you're there for them and support them. I often think, though, as people with, especially in a manic state, it will start to affect their daily life and their daily functioning and their job, and so then they often get to the point where they have to do something.
Yeah.
But I think it's so tricky because people ask questions like the people that I see like have sought out therapy themselves. Like I don't work with kids or teenagers anymore, so it's like no one's like forced to be there. So everyone's like there on their own accord.
Right.
So I think I don't have a lot of those situations, but I think it's always just like I'm here to support you, and like I said, I think people that have significant mental health problems, it will affect their life. I mean, it will really.
I agree. I was just reading some comments on Periscope, 100% about how it's good to talk about mental health so it ends the stigma. I love therapy. Like, therapy day is the best day. I get to talk about myself for like a full hour. It's 50 minutes, but I take the whole hour. And I take her whole time up. Because I can see what she's doing. She'll look at the clock. She'll be like, so what I want you to do this week, and then as she leans, I know what she's doing. As she leans up, it's a physical gesture for me to get up from my Kona. As she leans up to do this, I do this. So let me just tell you the other thing that I'm thinking of. I always do that. I'm like, let me just mess with you a little bit.
That's what I do. I have this like I lean forward and I have like my notepad and I'm like, okay, so this week.
I've been doing this for 20 years. I know when it's time to wrap a conversation. The only person that doesn't know that is Lance. I'm like, I literally say, Lance, it's time for you to stop talking so I can leave the conversation. And Lance goes, the history of the internet is as follows. And I'm like, no, but I actually really like therapy. And if people were more open to feeling comfortable enough to talk to someone about what's going on, you know, your friends aren't always willing to sit there and give you the time that you necessarily need to break everything down and take anxieties and like, you know, social situations and whatever it is that you're dealing with and going through and trying to get the help you need.
I think it's a different perspective too, you know, and it's like I recently started working with someone that came in and has like an abuse history and like things like that like you know, it's that's not something you're going to sit down and just like over a cup of coffee, you know, share with someone. And I think it's like a very, very, I think the feedback that I receive from clients is like my perspective is unique because like I'm not involved in it, and so it's like I just see it like outside and I know all the cast of characters, you know, so it's really feels like a very different thing than that. And I agree with you, it's like no one's going to sit down for that amount of time and like have it all be about you, you know, like when you try to make it about the other person, like no, but it's about you, like, you know, like before.
Do your clients ever cry in therapy?
Every day, and whenever people cry, they're like, oh, I'm so embarrassed, I don't want to cry. I'm just like,
do you ever get up and hug them?
I actually did last
Really?
week.
I can't wait to tell my therapist that.
But I don't usually cry when people. I never cry when people cry, but I don't usually hug them. In this situation, it was like
she was crying because nobody hugs her.
It was like a gut wrenching thing that she said, and I was like, like really, really horrific. And I was just like, I would look like a horrific person if I didn't hug her. I don't hug people when they cry though, and I actually don't offer a tissue always, only sometimes. That's actually something we learned in school.
Not to offer the tissue.
I sometimes do, but you don't want them to feel like they can't cry. So if you offer a tissue,
it means stop crying.
Stop crying.
Okay,
so,
that's interesting.
You know, sometimes people have like their makeup, and I'm just thinking, oh, you know, there's a tissue right there. Like maybe they'll, you know. But it's really interesting not to hug someone when they're crying. That's like a skill in itself. I think, 'cause it's like a natural thing.
Right,
you know?
right.
People, I always laugh when people like, as if I've never seen someone cry before, like, as if it's the first time, and I usually just say like, you know, or people block the crying, like, and always when I see the beginning of the welling, I'm like, I'm wondering what's coming up right now. I always mention it, and people cry. Like I can make people cry like that.
I always say that's the difference between men and women. Like, women have. There's something with our retinas that they'll well up, and then you blink, and then it's all like waterworks. Men don't have that unless it's tragic, right? Tragic or like, they don't. But like, say you walk into your boss's office and you're getting fired, like you're like, don't cry, be strong, but don't cry. But the minute your eyes well up, like I can't control it, and it's terrible. It's terrible, and it just it makes me feel so weak. I'm saying that to a therapist, a psychologist. Go, Connor. I know you have a bunch of comments.
Okay, Fan Wild says, Amber, how are you able to put aside your own struggles and anxiety when you go into session with patients? It seems hard to compartmentalize and not think about your own stuff when listening to patients.
Well, it's hard at times. I think right now I have a lot. Like it's been interesting. Like my wedding's in 5 months, and like there's just a lot of thoughts about like my own life transition and all that stuff all the time, like excitement, but like anxiety. I mean, it's a normal thing. But what I try to do, you know what, you said something really interesting a few weeks ago. I listened very intently, so when I remember, I have a crazy memory for things. You said that like someone asked you like, how do you manage like your kids and your life and your workout and your all this stuff, and you said like, I put 110% into whatever's right in front of me, and that's kind of like I guess that's like what it is. You know what I mean? Like I have to put 110% into what's right in front of me.
Right.
Because like what's happening, you know, my mom calling me and asking me to proof an invitation like 5 minutes before my session, like that's not like that is not what's right in front of me. What's right in front of me is someone who's paying me for my time, for one, and also who, you know, so I think it's really like that. I mean, I guess that sums it up without me even like coming up with, you know. But
sure, just use my answer.
Like
That's cool. Go on, Connor. That's awesome.
Okay, Kathy says, don't feel bad. I'm okay. My partner committed suicide. Do you think I'll need therapy for the rest of my life? I'm doing fine. Just to let you know.
Good. That you're. I'm sorry. That's awful, Kathy. But I'm glad that you're. Sounds like you're getting help and you're doing okay. So good for you.
And I don't necessarily think, I think that you need therapy, like, as much as you need therapy, you know? Like, I don't think that, I mean, I'm really extremely sorry to hear that, but it sounds like you're coping and feeling like you have the support that you need. So I don't know, I mean, I think sometimes people feel like, oh, this very horrible thing happened, so I'm going to be in therapy or never be well or be, you know, for the rest of my life. And I don't know if that's necessarily true. I think it's a very case-by-case basis.
Patty says, I've been bipolar for over 30 years and it's a hard disease. People just don't understand it, and that makes it difficult.
A lot of bipolar people.
Yeah.
I mean, bipolar is...
Right, I think a lot of people throw it around though, like without it being like diagnosed. Like if anyone does something, it's like, oh, that was so bipolar, or that was so, you know. But I mean, I would wonder about like a medication. I mean, I presume if you've been bipolar for 30 years, you've like consulted with a psychiatrist. But often, like that can really help with the symptoms. You know, I mean, often it's medication therapy with bipolar disorder.
The only bipolar person I knew, obviously, was Carrie from Homeland, and she took her medication in seasons 1 and 2. In season 3, she stopped. It was not good for anyone. Back on it in 4 and 5. And this season, we just haven't discussed it. Now, I understand fully. That's not real. I get that. But just as far as I just wanted to be part of the conversation. So I wanted to contribute something, and now I have. Go ahead, Connor.
Simon says, you need to have Amber back once a month.
They like ya.
Yeah, and
I'm happy to come once a month.
Brooke Shin said, so nice to see Amber back. Can't wait to hear some insights. Elena Kaplan said, Amber is so great. And then here's a question from Hazel Eyes. He asks, how do you feel about the use of cannabis for mental health treatment?
It's a really good question.
That's a really good question. So I don't know that much about the use of marijuana for treatment, like medicinally. I do think it probably is effective for some people. Like this is like just kind of like a personal opinion. I haven't read up on research on this, but I mean it makes sense that it would make people with high anxiety feel. I mean anyone that's ever been high could probably know that, like it makes them feel. And I imagine like when people have pretty severe anxiety at some point, it's something that is considered.
Right.
But it's a really interesting question, actually. Really something that I.
I don't remember. Is it legal in New York? You're probably going to overanalyze how many times I put my scarf on and take it off. I can't decide.
I don't think it's legal in Colorado. It is.
Right.
Connor, do you know?
If it's legal here,
yeah,
it's decriminalized, but I don't think it's legal. So you can smoke it in your apartment.
But not out in public.
Yeah.
That's alcohol, isn't it? You can't walk down the street with alcohol.
Yeah, I guess essentially the same. But you can also drink alcohol and beer. And in Colorado, there's places like
right outside you can just
where
smoke.
You can smoke. Yeah.
Wow. Okay.
Yeah, that's.
I doubt that they know what. Oh, that's nice.
So anyway, I wanted to recap.
Yeah.
Some people are wondering what the credentials were here.
That's good. Oh, I'm a psychologist. I'm a psychologist. I have a PsyD, which is a doctorate in clinical psychology, and I have a master's degree in psychology as well. And I'm licensed in New York and Pennsylvania.
And I'm sitting next to a psychologist, so those are my credentials. So there you go.
Yeah, that was a good question.
What was the question?
Intimacy or something.
Oh, what was it?
Performance or something.
Here we go.
It goes very quickly.
Yeah.
It's from George Bozeman. Doctor, I feel anxiety about intimacy. I keep thinking my guy will perform badly. Advice?
Do you know what he's talking about? Are you reading between the lines?
I'm reading between the lines.
I
I get what he's saying.
Oh, okay.
Get it. I was like, he is gay. No, he is. Right.
No, he's not.
He's not?
You think he is?
I thought he just said my guy.
Yeah.
His guy.
Oh, his guy?
Yes,
Oh,
that's not. God, you guys, honestly.
Jenna, where's your mind?
Okay, so
no, that's what he meant.
I know that's what he meant. I know.
Am I the only one that got this?
I thought he meant like guy and guy.
You got it?
No.
No.
Oh, you didn't get it? It was just you.
I'm the only one that got it? I'm totally
Well,
right.
Thank you for
See, my little man. See?
Little man. Okay. Well, I think it's interesting that you said little man. Little, I mean,
Connor be like, my gigantic man.
Yeah, I know, right? Well, that's the first place to start. I actually do work with men with like performance anxiety.
I still can't believe you guys thought it was just. Anyway, go on. Yes,
okay. And I think it's really important to identify like what the anxiety is about.
Okay.
And also be able to do things before an intimate interaction that help you to go in feeling relaxed, because often when people are anxious, they think about being anxious and then they become more anxious. So it's like, I can't perform. I can't perform.
Never perform. It's never
right,
works.
right,
Never
and then
works.
it just perpetuates itself. So I think it's also good for your partner, whomever that partner may be, because we aren't sure. For your partner to also know too, because I think if that person's calm and you're calm. I mean, I have a few men right now that I'm working with in performance anxiety.
That would stress me out as a guy.
Yeah, and it is really distressing.
You don't have to worry about that.
Stressful. Yeah, I mean, but I think that sometimes, right, exactly, but I think that sometimes there's like greater issues within the relationship.
Sure.
Well, Warren Brandis says, Amber's mom is watching, and Jenna, you were so funny.
That's my mom.
Oh, hi, Mom.
Yeah, that's my dad's boyfriend.
Ah.
Kelly Williamson said, LOL, just picked a funny time to tune in. Quotes my guy. Alright. Fan Wow says, how can we change the stigma around medications for mental health treatment? I'm not ashamed to need Prozac to keep me even keeled. And here she said, LOL, my little guy.
Yeah. Well, I mean, I think that we change stigma by talking about things. you know what I mean? Like,
great
by
idea.
this, and
Great.
like someone just said once a month, like, yeah, let's talk about this once a month. Let's talk about these things, because that's how stigma changes. It's like, how does any stigma really change? You know, how does the stigma of, you know, I can't even think of that. I mean, I feel like we talk about
getting
it. It's like,
hey, out in the open,
I'm on this medication. That doesn't mean that you're not a functional human being. That doesn't mean that there's something wrong. And also knowing that like millions of people are on medication and have very good jobs and very successful careers, and it's not something that people know about, you know, because we don't talk about it. So I feel like that's how we change stigma about mental health in general.
Sure.
Like, I talk about mental health any opportunity I get. You know, like, I'm on a plane and, you know, people, I think I have like a sign, like, psychologist, you know, people always, like, sometimes it's a lot, but I do talk about it anytime I get.
Someone made a good point. I found that when someone brings up the subject, everybody seems to chime in, which is, we've had more engagement here on this subject than anything else.
Right.
Which is great.
Right. I agree.
Go ahead, Big C.
Actually, you keep going.
My thing, I'm stuck. We're in a really pretty position where you are very excited to look down, and I'm just looking straight ahead as if I don't know what.
We'll see.
Everyone's
Okay. This is from Jay Lada. He says, my bro is bipolar and is currently manic. How best to support and encourage to get help?
I think kind of what we were talking about before, I do think that often people's day-to-day life will be affected, and I even think maybe helping to point that out to the person, not in a judgmental way, but saying, you know, I'm noticing that, you know, you're struggling to make it to work on time, or I'm noticing that you're, you know, not available, or, you know, whatever the behavior is that you're noticing, or the impulsivity, like, I'm noticing that you're making choices without thinking, and how can I best support you? I think it's always like that line, and I know it's like, oh, well, that's obvious, but I think that people don't think that. It's like, I need to get you help, and I need to tell you what to do, and like, if you tell someone what to do, they're not gonna do it. So it's always like, I always try to kind of like angle it in that way.
Right.
You know, even with my clients.
Yeah,
like,
and that's smart. If you tell someone what to do, they're not going to do it. Right. I always find I think I told you this last time, there are 3 things that you just absolutely cannot convince someone to do. They have to want to do it. I have found. Right. Stop smoking, lose weight, and break up with someone. Like, those are 3 things that they need to come to on their own, and I would say probably getting mental help is one of them as well.
The break up with someone is interesting, like, as a therapist, because I've had people, like, I won't tell people to do it, but I point out all the signs, like, so you know this thing, and this thing, and this thing, and this thing. Oh, and you know what, then we broke up. And it's like, okay, well, I just guided you to see the clearer picture, because people like to avoid the real, I think people often avoid
I was in a really bad relationship. It wasn't a bad relationship, but when we fought, it was a bad relationship. I liked her, and we were starting to fight a lot, and I would run to my therapist every time, and she finally said to me something I'll never forget. I said, do you think it's going to work out with this girl or not? And she said, no, this one isn't going to work out. I just don't think it will. I said, what do you mean? I thought you're like Josephina Positiva. Like, you don't think so? She's like, no, this one's not going to work. And I never forgot that. So did I run home and say, oh, my therapist said I had to work? No. But I always knew that even after I broke up with her, I remembered her saying that, and it was good. It was just what you said.
Right.
She did not tell me to do it. She just sort of gave me the ammunition to feel good and feel strong and confident about doing it. So that was good.
Right. And I think sometimes with relationships, if people ask that, depending on how long I've been working with them, I'll say, you know, well, it sounds like everything that you've said does not seem like this is, you know, this. I point out what they have said. Like, I put it on them. Like, you've said this. That's why it doesn't seem like this is going to work out. I mean, do you know what I mean? Like, kind of like saying it in like a flip way. Right.
Someone just asked, what's the best way to handle somebody coming off an addiction?
That was Sherry's.
Oh, sorry. Thanks, Sherry.
So, like, coming out of treatment type of thing?
Yeah.
I think that depending on what the treatment is and what the addiction is, that they need a lot of support, and they need to not be in with the people or the places that
put them there in the first place.
So, any addiction, I just think sometimes people come out of treatment and think like, oh, I can kind of go back. Like, I know people that were able to like go back and like be in bars and have just recovered from alcoholism and things like that. But that's very rare. So I think like initially, and I think again, it's saying to the person, what do you need from me?
Yeah.
Like I always think that's like the question, what do you need from me? I even say that to my clients. What do you need from me today? Like if people, like that gut-wrenching situation, where I helped the client recently, I said, what do you need from me in this session? You know, how can I
Did she say cash?
Hazel asks, how do you see people suffering with PTSD, and how do you treat them?
You're getting every question. You can
I know.
Like I hope you studied before you came in.
I mean, I don't work like a lot with severe trauma, so I would probably, and if someone had severe PTSD, I'd probably refer them to someone that does. But with PTSD, there's a lot of like grounding. Like I work with, like I said, someone just came in the other day with like a traumatic history, but it's like a lot of it is like containment and grounding, because like the symptomology needs, it helps people to feel kind of better in that way. So like being able to like be in their body and their space and like know what their triggers are and all that kind of stuff. But with like severe trauma, I would probably if it was like something very severe, I would refer them to someone that specializes in that.
Gotcha. Have you had clients that you've had for a long time?
Yes.
Okay. Do you think of them as like, are you a little like, I feel like you should move on, or?
Well, I have to pay my bills.
Right. But if it wasn't about money.
Yeah, no, I don't have anyone. I do, when clients get to that point, like I have someone that like I was seeing multiple times a week, and now we step down to 2 times a week, and now we see each other once a week, and like that was me bringing it up, which is an interesting therapeutic dynamic, right? That I was the one that said, in terms of like let's step down.
Yeah.
If someone needs to wrap up, like it's unethical to continue, I would say, usually I'll say like we're at a crossroads, like what do you think we'll continue doing, and what do you think will, like what's the next step? I reevaluate goals every few months with people.
Well, that's
so
smart.
Like, what are we doing here? Like our, that type of thing. So, So if it is a point, look, like maybe we're going to meet every other week, or maybe we'll, we usually people taper down, but I don't have anyone where I feel like this person really should. There's no, because it feels like, and for a lot of people, like I'm like their. I think I mentioned last time, like I'm like their stability. And one client said I was her lifeline, but like I'm like the stable
thing in their life.
Kind of makes me.
No, you're like the awesome thing. You're a beacon. You're amazing. You're the best.
Thank you.
You're the best. Nobody's better. I just want to make sure that my therapist doesn't look at me as like a loser because I've been with her for so long. Let's take a few more and then we'll wrap up.
All right, Olivia's life says, can you really help people? And Beak Abe says, nothing worse than going to a therapist with nothing to discuss.
I've gone where everything's sort of okay and it's just maintenance.
Mm-hmm. Yeah.
I mean, I could think of things that are worse than going to a therapist with nothing to discuss.
Yeah, and I think when people come in, and I mentioned this last time, and I think Lance really liked it, like the kind of collaborative, relational part of it. Like my expectation is that you come to therapy and this is your therapy session, what you want to talk about. But I also know, like the clients I work with, like I know them. So if they can't come up with something, I'll say, I'll always pick something that they're avoiding. I'll always pick something that they don't want to talk about. So like, if you want to put it on me,
you guys are all the same. That's exactly what she does.
I'm happy to pick something out for you, but I don't know if you want to leave it to me. So most therapists will do that, or I know some people kind of stylistically will sit there and let the person just quietly think.
I'll choose death.
Right, which is something I'm actually working on, is like in terms of my own self, because professionally, because I think sometimes I'll be like jumping in with something, and it's just like, okay, like just in like, because, okay, some people need to sit and process, and I'll tell clients, I told a few people recently, I want you to process, and I want you to think, and then if you can't come up with something, we'll come up with something together.
Yeah.
Yeah.
Was this the Jenna that used to be on the Today Show? Yes, that's the one.
That was Darren.
Nice. Thanks, Darren. Darren's a joker. Darren's a joker.
You used to be on the Today Show?
Used to be.
No way.
Yes, way.
No way.
I love you being on here. It's so comfortable and so easy, and like time flies and all of it, and obviously our audience loves having you here, and they can't stop with the questions, even though you can compartmentalize all the questions into anxiety and bipolar. But it just means that that's what's out there, and that's what people are talking about. Would you come on once a month?
I would love to come on.
She wants to come on once a month. Okay, we'll pick a day that works for you, and we'll knock it out. We'll get it on the calendar, and then we'll bring up different issues. We'll sort of break them down and.
Yeah,
and
no, I'd love to. I mean, and if anyone has any like topic, I mean, I'm not going to do like a poster presentation, but I'd be happy to like. I can talk more about like CBT technique. There's like more things I could go into really easily, but thank you guys. This was fun.
How can people, if someone wants to get in touch with you, how do they get in touch with you?
So some of you guys added me on Instagram and Facebook, and you're welcome to do that. My email is Dr. Amber Brandes, DrAmberBrandes@gmail.com, and Connor could just like maybe link. You could maybe just like, put that on Instagram or something. I'd be happy to answer any follow-up questions. This was fun.
Did you have fun?
This is super fun. I am loving. This is like a new side of myself that I never knew.
And you're more comfortable this time, right?
I'm a lot more comfortable.
And you'll be even more comfortable the next time.
Yeah.
I love it. Awesome.
So this is fun. Thank you guys.
Of course.
Of course.
So I don't know why I'm saying it. She's like, thank you, and I'm like, of course. It was all me.
Thank you, Jenna.
You're
it was
so
really fun.
welcome.
So once a month we'll do a segment, and as long as I get it in my calendar and know when it is, I can kind of schedule my, like today worked perfectly.
Perfect.
So,
good?
We just, two things. Livia's Life says sorry for being rude earlier.
No rudeness.
She came around. She's a fan now, I think.
Oh, what was she before?
She didn't think that anyone had any credentials to be talking on the show.
Gotcha, okay.
And now she's saying yes, she's a fan.
Gotcha.
And Beak Abe, I don't know if I'm pronouncing it right, but he says, where in Pennsylvania do you practice?
I practice in Center City in Philadelphia. I also work via like video conference like Skype. I mean, I actually have people not in these areas, so like I can do remote things as well. So if anyone's interested in any questions or anything, contact me. But yeah, in Philadelphia.
Cool. All right, thanks guys. We're gonna take a break, and when we come back, you're gonna meet the real Allie Beck. That's all I'm gonna say. All right, Connor.
All right.
All right, we'll be right back.
Bye, guys.